Healthcare enrollment is here. Medicare enrollment already started earlier in October. We're just a little over a week away from the Affordable Care Act health enrollment period. If you haven't thought about either, now is the time. And we are joined by our experts, Medicare and ACA experts, to help you out this evening. We've got Catherine Sevier from AARP North Carolina, Laura Packard with Get America Covered, Steve Edmonds from Alliance Insurance Services. These folks are here to answer your questions. So this is how you get your question to our experts. The number is 336-379-5775. Remember, you get your question answered in real time, but the question is anonymous, so ask whatever it is that you want to ask. All right, first and foremost, we're going to start with just the basics, and that is the calendar. So let's put up the calendar so everyone is clear on the dates for either Medicare or the Affordable Care Act. Okay, so you see Medicare enrollment began earlier in October. That's in the orange. You'll also notice orange in December because that's when Medicare enrollment ends. That is December the 7th. Look at the blue. That is the ACA enrollment, and that begins November the 1st, and it ends January 15th of 2023. Okay, so Steve, for folks who are like, well, I'm already signed up for Medicare, so what does that mean for me?
Okay, so this is just a time of year beginning on October 15th each year where we have an annual enrollment cycle that comes around. And it's just the perfect time to reassess your plan each year. Lots of stuff to look at with your plans, like what's your maximum out-of-pocket cost on that plan? What are your co-pays on the plan? How is the drug coverage? Is it going to be as good as it was last year? Is it going to be better? Is it going to be worse? And then you have the extended benefits like vision, dental, hearing, and over-the-counter drug coverage that also comes with a lot of these plans. So this is just a great time of the year to reassess your plan, and don't be afraid to do that. I mean, there's tons of plans out here, a lot of options, and it's just a great time to go over it good, examine it good, and consider, do I need to make changes or am I good where I'm at?
Okay, so that's for folks who already have Medicare. So what if they're like, I'm coming up on 65-ish. Is this my enrollment time? Okay, so Catherine, let's answer that.
So 65 is the golden year that you have to sign up for Medicare. So you want to make sure that you do it 3 months before, the month of your birthday, or 3 months after. Even if you are insured, you still need to sign up for Part A and check with your employer to make sure, if you're not going to sign up for Part B because you have other insurance, that your insurance is a qualified policy for you. If it isn't, you will pay a penalty forever when you do sign up for our Part B benefit, which is all your doctor's visits, radiology, and most of your outpatient activity.
All right, so if you are, coming up on the age of 65, this might dovetail with Medicare enrollment, but if it doesn't and you turn 65 like in July of next year, you're going to hold off and wait for that 7-month period. Again, the 3 months before, the month of your birthday, the 3 months after, that kind of thing. Okay. Laura, let's go to you. Let's talk about the Affordable Care Act, because once again, enrollment is coming up. It starts November the 1st. What do people need to know?
Well, you can start shopping right now. You can go to healthcare.gov and see what plans are available. So you can do a little window shopping now before November 1st. You want to make sure that you sign up before December 15th if you want your plan to start on January 1, but you do have until January 15th. If the holidays are just too much and you can't quite get it together, it just means your plan will start a little later in February. So start shopping now.
Right, and I know that seems like a long time, but once you get into the holidays and stuff like that, people then start looking at other things and they don't start paying attention to their enrollment, and it can kind of sneak up on them. If they have ACA enrollment from last year and they think to themselves, well, if I don't do anything, it'll just stay the way it is, what would you say to that?
Well, your plan should auto enroll, but I would strongly suggest checking out your options because plans come, plans go, they change. The same plan that you were on this year is maybe not the best one next year. And also, if your income has changed at all, it could be that you're eligible for more financial help. So definitely you should go to healthcare.gov and go through your options rather than just auto enrolling.
Okay, and here's something else too. Healthcare.gov has all the things listed there. They have some helplines as well. But Steve, I know if folks talk to an insurance agent, they can have the insurance agent kind of go over certain things with them, help them steer them to a plan. You don't have to pay for that.
That's correct. And we hear that a lot. The healthcare.gov system, it's really great anymore. I think it's very user friendly and really easy to do. But that's one of the biggest things I hear on a day in, day out basis is people get confused when they start looking at that and looking at the plan options, and they don't really know what to sign up for. And sometimes they don't know exactly how to answer all the questions that's asked on the computer. So an insurance agent can help navigate that for sure. It is free. There's no cost to do that. And a lot of times, if you go ahead and sign up with your plan through that agent, you've got him to help you throughout the year as questions come up as well. So using a qualified agent or navigator is a really good source with the ACA, I think.
All right, so we're taking your text questions. I already have a list of them. Feel free to text in your question. We want to answer them for you so that you have all the information that you need for healthcare and Medicare enrollment. We'll be right back. All right, we're back with our Medicare and Affordable Care Act experts, Catherine Sevier with AARP North Carolina, Laura Packard with Get America Covered, Steve Edmonds from Alliance Insurance Services. All right, Steve, I think this question is for you. It says, do all Tier 3 drugs have a deductible no matter what drug plan you choose?
They do not. And again, this is a complicated question. A lot of your Medicare Advantage plans, which are also referred to as Part C plans, many of those do not have deductibles on Tier 3 medications. However, if you're on a Medigap policy, which is an older type of coverage that's been around for years, but it's a really good coverage, but most people on those plans have a standalone drug plan. And with the standalone drug plan, it is very common to have a deductible for a Tier 3 drug.
Okay.
So it's according to which plan you're on. You know, it could be a yes or a no. It's according to your plan.
Catherine, this person says, I have Medicare and TRICARE for life. Do I need Part D or anything else?
No, TRICARE for life actually stands in as your Part D and your supplement. So once you have Medicare for life, TRICARE for life, it is for life, and it stands as a supplement as long as you're in conventional Medicare or standard Medicare.
All right, Laura, this person is following up on a question. I think we'll answer it for both ACA and Medicare, but for ACA, it says, if I stay enrolled with what I have and I don't make any changes, does it just re-enroll me automatically? Oh, I think Laura's frozen on the bus. Okay, so when it comes to ACA and Medicare, I'm sure, Steve, you can answer this question as well.
Okay, so let's take Medicare first. Your Medicare plan will automatically roll over. So if you're satisfied with it, you're loving the plan, you know, and you don't need to make any changes, it will automatically roll over, no problem. So yes, it will. On ACA, that is more complicated because it will automatically roll over, or it should. But there are so many things that need updating on those plans, like has your income changed? Has your household income or dependent status changed? Did you get married? Did you change jobs? A lot of stuff needs to be reassessed from year to year on an ACA plan. So I would recommend always doing an update on that.
Okay. All right, like this person is asking, which company has a benefit to pay for in-home custodial care for the elderly? Catherine?
Most health insurance plans do not have benefits that pay for that. There are some opportunities when you're in a Medicare Part C, through a Medicare Part C or an Advantage plan, they may have relationships with hospice and palliative care programs that they will help support. The one exception to that is if you are what we call a dual eligible person who has Medicare and Medicaid. There are some benefits provided there, but you have to talk with your provider to get yourself hooked up with those. They don't just automatically happen. They happen because your provider makes the appropriate referral.
Okay. Let's talk about dental benefits and Medicare now. So they're paying more for dental benefits. Is that what's happening this year, Steve?
Yes, a lot of your Part C plans, are the Medicare Advantage plans, a lot of those give really good dental benefits. It's common to see like $1,000 a year limit there that you can spend for dental. Some have as much as $1,500. Some have $2,000. So it's some really wonderful dental benefits under the Medicare Advantage plans. Now, some people, as we referenced a while ago, do have the Medigap plans with a standalone prescription drug plan. Now, on those type plans, there is no dental, no vision, no hearing, and no over-the-counter drug coverage with the older traditional plans. But on Med Advantage plans, yes, it's wonderful wonderful dental coverage on those.
Okay, and you do have to ask your dentist if they are accepting Medicare. You're nodding yes, right, Catherine?
Correct.
Okay.
Right.
Okay. Just like everything else, they may not take that insurance, just like they don't take your private insurance, that kind of thing. Okay. So this person says, I'm still employed with insurance through my employer. I did sign up for Part A at 65. I'm over 70. Does Part A cover what insurance did not?
No, it doesn't. Part A is your hospital plan. Part B, which it sounds like you didn't sign up for, is the one that covers all of the things that happen to you on an outpatient basis. So I would assume that your employer-based insurance is picking up those costs like they would as a primary insurer, but you could still have a deductible and probably will.
Okay, and just quickly, they need to sign up for Part B, but they're already going to be paying the penalty.
They won't be paying a penalty if their group coverage was, if it's the acceptable coverage. Usually employers that employ 20 or more people would have an acceptable plan, but you always really need to check that out. But
okay.
if this person, if they're age 70, when they do retire, they really need to tap into that Part B quick, within 30 to 60 days.
Okay, once you retire, you have to tap into Part B, 30, 60 days. All right, we're going to take a quick break. We're continuing to take your text questions next. We're going to take a quick break and look at the forecast for the weekend. We're back with our Medicare and Affordable Care Act experts. And so, Laura, I wanted to toss it out to you first, and let's talk about some of the changes that we're seeing this year because of the inflation bill.
Well, the Inflation Reduction Act, which just got signed into law a few weeks ago, has all kinds of good changes for your health care. For the Affordable Care Act, it means that the premium costs are going to continue to be capped at 8.5% of your income. So that's good news. For another 3 years, those ACA plans will continue to be affordable. Also coming soon for seniors on Medicare, your out-of-pocket drug costs are going to be capped at $2,000 a year. And starting next year, some basics are going to be included in your Medicare, such as the new shingles vaccine. You'll be able to get that, as well as they're going to smooth out your costs throughout the year so that you don't face a big drug bill in January, but it's throughout the year. So there's all kinds of pieces in the Inflation Reduction Act that will affect your care. That's why I am here on the Protect Our Care bus tour talking about it, and we'll be in Greensboro on Monday.
All right, gotcha. All right. So this is another Medicare question. It says, my son's going to be 65 in 2 weeks. He tried to sign up on Friday, and they told him if he was working and had insurance, he couldn't sign up for Medicare. So, Catherine, what should he do?
Well, he still has to sign up for Part A. And then if he's in a deemed plan, he can waive or not sign up for Part B, but he definitely must do that. So send him to Medicare.gov to look at that, or have him go work with an insurance agent to get him signed up. But that is not accurate, and he could end up paying penalties later that could be avoided, and they will be for life.
Yeah, all right. On top of that, this is another question. My wife is turning 65, but she's covered by my insurance. We know she needs to sign up for Part A, but we would rather delay signing up for Part B. Eventually, she'll sign up for Part B. Our concern is that 10% penalty. So, Steve, what exactly do they need to do?
First of all, they probably need to talk with their human resource people through that group plan. Make sure that that group plan is a credible coverage and meets that definition under federal guidelines. Then, if that's the case, she can stay on that group plan and she can delay or defer the Part B until later on when she needs it. And then when she does need it, you sign up within 30 to 60 days of losing that group coverage. And if you follow all that and all those guidelines and all that's all good and well, there is no Part B penalty. So she's in good shape.
I just want to clarify. So like when you sign up, she's going to check the box for Part A. And for Part B, it either says deferred or take it, right?
Right.
Okay, and so she needs to hit deferred. So you can't leave the boxes empty, I guess is what I'm saying.
Right, correct.
Okay.
Yeah, she needs to make that election and make that clear. Yeah.
Okay. All right. So just very quickly, let's go through the dates so that everyone knows. Catherine, when is the cutoff date for Medicare enrollment for this open enrollment period?
December the 7th.
Okay. And then, of course, 65, you got that 7 months. And Laura, again, let us know what those dates are so we don't miss it.
Well, you start signing up November 1st, which is real soon, and then you have through January 15th.
Okay, so you got a good amount of time there. That may mean that you can go on healthcare.gov right now and look at those things so that it doesn't become a last-minute decision. Thank you all for your time and your expertise. We so appreciate it. And again, you're going to be in Greensboro on Monday at 3 o'clock to talk about that. So if you have questions, that's another place for you to go as well. If you missed any of this information, we're going to put it all on our website for you. It's in the Who Wants to Know section.